Hey everyone, it is Jeff Douglas, Doctor of Physical Therapy and Certified Athletic Trainer and owner of The Defensive Doctor, providing mobile physical therapy services to those in the Minneapolis area. And today we're going to talk about if you're having some sciatic issues, okay? So many of you probably heard the word sciatica out there. And what that is when there's usually a nerve root irritation of the low back nerves in the lumbar spine. It can send pain or tingling numbness down the leg into the foot. And there are potentially ways to correct this on your own, all right? I will always advise that you go see a proper medical professional and actually see them one-on-one so you can actually hear your whole story and make sure there's not some nastier stuff going on that may be causing these issues, all right? It's always a better bet to do that. But in this case, I want to give some ideas because it may help some people out there, at least they can try. Now, again, you learning it through YouTube is much different than having someone watch you and guide you through it, because you still could be doing some things wrong or improperly in your own case, because everyone's case is very unique. So I always just have to say with a caution, be careful when you use stuff on YouTube or online, seeing someone in person or virtually, but you're having that one-on-one time with them. It's going to be much more beneficial. Okay, so say you wake up one morning and you have some sharp pain going down that right leg, all right? Hurts to bend over for the most part, and it's just this sharp pain. It's debilitating. It's keeping you out of work. You can barely walk. You're limping, weakness, okay? So let's talk about if there was a lateral shift with it. So for some of you, you might wake up and you might be like this. So a lateral shift is what we call it. So and a lot of times it's opposite of the leg that hurts. So say my right leg has the radiating symptoms, my left shoulder would shift away from that pain. It can be this other side, but a lot of times it's going to be away from it, right? It's almost like running away from the pain. Okay, if this is your case, so it's either you have a lateral shift that we visibly can see. For some, if you had your arms, and you stood like this, you would see a bigger gap on one side versus the other. That's when we know we have a lateral shift. In other cases, it's a lot more subtle, and we'll notice that someone can't laterally flex as far, all right? So you would have to measure how far you can laterally flex if one side can go farther than the other, okay? When it's something like this or like this, where it's a lot more noticeable, easier to determine how to treat, okay? But say this is the case, what we would want to do then is, if I was there, I would come in and I would put my shoulder right on your torso abdominal region here, and then I would reach around, grab your hips, and I would gently slide your hips to try to put those shoulders back over your hip, okay? And what we're doing is we're just trying to mobilize that lumbar spine, which can sometimes calm it down, all right? And people feel a lot better. So we would do it 10 times. And how hard I pulled is all determined by if you have your symptoms get worse or better. So if I'm going like this and you're like, it's about the same or it's no worse, or if it's getting better, I would do a nice intensity, but if it's getting painful, I would do a lot gentler motion with that, okay? Now, obviously, I'm not there, or when you're watching this, you're not with a practitioner who would do this, okay? So I will show you at the end of this video, we're gonna jump back to this, how you could do it at home, but pretty much we would get you up against a wall, and say the wall is on my left shoulder. You would go to the side that the shift's on. So if it's a left shift, because our left shoulder's moved over, we would be against the wall with our left shoulder, and we're just gonna slide that hip back against the wall, and then but I'll show you that at the end, okay? So say we corrected the lateral shift. So you have to correct the lateral shift first. If you don't do that, this other stuff I'm talking to you about now won't matter, all right? Or some of you may not have a lateral shift, and then this stuff pertains to you. So now there's two motions that we're gonna test. You're gonna do 10 flexion, bending over, and 10 extension, and you're gonna see if either of those make it worse. Now, many of you are going to come in and just know that bending over makes you worse, so we're not even probably do it, okay? But for some of you, you might do some of this back bend here, okay? And you'll be like, and then you'll stop, and you'll be like, ooh, that feels better, all right? And there's different tests that we would do, like you'd be on your back, I'd lift the leg up, or you're seated, called a slump test, your legs out, and we'd retest to see if it made a difference on it or not, all right? For you, it might just be testing different ranges of motion after you do it to see if it feels better, okay? Or can you walk a little better? Sometimes you can get some pretty good results right away. Other times it's a much slower process. So say you did this and it doesn't hurt and it feels better, okay? Well, we know that this extension would be an answer for potentially improving your sciatic. And you feel that those symptoms start coming back to the back. And then when it comes to sciatica, if the symptoms disappear in the leg and it gets really sharp in your back at one point, that is good. Even though your back pain is worse, but the symptoms in your legs are gone, that's progress. We don't want the symptoms in the legs. So don't freak out if you start doing some stuff, or if you're with a practitioner and you're working with them and your back pain gets worse, but your symptoms leave here, that's a good thing, okay? This will go down next, but we gotta get it out of the leg first. The other option you could do is you could lay on the ground and you would just do some gentle press ups like this as well, okay? And that's an extension too. It's from a technique called McKenzie, all right? It can be very, very powerful for those who are dealing with radiating symptoms. Others, though, might find that flexion feels good and extension feels bad, and you would do reverse. You would work on bending for some, okay? I would say that's far few compared to the other one, extension. Usually extension is going to be the answer. But again, you have to identify in your individual case. It is not the same for everyone, all right? So I'll quick show you a video from the side glides against the wall. But usually I just have patients do about 2 by 10 throughout the day with whatever motion that we identify in the treatment that makes their symptoms better, okay? So let's jump over to the wall and we'll just show you a quick demonstration of a lateral glide if you were just to treat yourself. All right, so we're at the wall, okay? I, per se, have a left lateral shift. I am going to put, and again, that means that my left shoulder has shifted over, okay? I'm gonna lean against the wall. I'm gonna put my outside foot in front of that back foot, okay? Hip, hand on hip. And what you're going to do is you are going to shift your hips back under your shoulder here, okay? Now, for some, the closer you are, the easier it is. And that's where you need to be. But if you start doing this and you start feeling your symptoms get worse or going down farther, that means what you're doing is too intense. So maybe you started out here and I go, oh yeah, that really aggravates it, okay? Because I'm farther away, it's more intense of an exercise. I'm gonna make it less intense by moving closer to the wall. So now I move a little closer, I would try it. Okay, that doesn't hurt. So I do 10. And so what I tell people is I want them to do 10 every hour. All right, so if you're at work, you would get up, you would do your 10, or if you're at home, just every hour, put a reminder in, you would stand up and you would do the exercise 10 times. But you have to find that distance. Closer you are is less aggressive, farther out is more aggressive, but you want to try to see how far you can get out without aggravating. But it's important now, when we do this, it's a shear. We want our spine to go like this. I don't want to see a bend, okay? So many people will want to go here and they do it. They'll bend, okay? They'll almost like make it like a C right here versus just keeping this locked in and just shifting. So this stays here, just shifting my hips in a straight line like that. Very important, shear force versus a bending, okay? When we're doing this one. So if you had a lateral shift, we want to correct that first. So we did this, okay? And then say we corrected it and you're still having those symptoms, then we go into the extension or flexion part of it that I went over earlier. But you have to take care of this first or you're not really gonna have much success with the other things, all right? So give this a try if you're dealing with some sciatic pain, see if it helps. But again, I can only recommend or highly, highly recommend that you go get some actual guidance when you're doing this because we don't wanna make the situation worse. Hope this helps. Let me know if any questions. Take care. Thank you for watching this video. If you found this information useful or helpful, please subscribe to this channel. Just drag that mouse right over to the red box, click it, so that you're notified the next time that I post a video. Again, thank you so much.